Nearly half of the deaths in Kern County related to COVID-19 come from skilled nursing facilities. So it's obviously very bad in Kern County and in the state of California. But from AARP's perspective, how bad is it? And is it going to get worse before it gets better?
Danielle, has reached pandemic and crisis levels. In California, there have been 5,600 deaths. Of those deaths, 2,300 were in nursing homes. It's 50% of the deaths that we are already experiencing. It is a significant problem. And at this point, we're demanding change. We're demanding change at the federal level, and we're demanding change at the state level.
What specifically do you think led to it getting so out of control within the nursing facilities?
Well, we all know that these are the oldest and most vulnerable. These are individuals who have multiple chronic conditions. Those are some factors. Unfortunately, there were no protocols in place. That means no action plans put in place on things such as washing your hands, wearing masks, wearing gloves, wearing gowns. And then if somebody were positive, quarantine them or separating them from the rest of the residents. Those simple steps were not being taken. It's also the staff. So you have staff who are working in multiple nursing homes. They go home, they come back into a nursing home. They may have picked it up in one of their other facilities, and then they bring it into one.
So what is being done now? And has there been anything at all that's been implemented to help stop the spread?
In California, if you're a facility of 10 beds or less, you're not required to report. So we need to change that. We need every single facility required to report. We want more money for testing. We need to know when people have COVID-19. We need more reporting. And we also are asking for the virtual visitation, is simply giving people a phone. Let them have a telephone, their own cell phone, allowing them to do FaceTime and see their loved ones.
Kern County Public Health Director Matt Constantine has expressed his frustration before about nursing facilities that have confirmed positive cases still being allowed to take in new patients. What is your reaction to that?
So the problem that we have with that is that many nursing homes are receiving more money for a COVID positive patient. That is a program that not only the Centers for Medicare and Medicaid have allowed to happen, but at the state, they were giving up to $1,000 for a COVID positive patient. We have heard some pretty egregious stories, what we call as involuntary transfer. That's a nice way of saying patient dumping, where they're removing people who are healthy without their approval, not giving families notification, and they're either taking them to a homeless shelter or a board and care facility, which do not have the staff, medical staff and otherwise, to be able to provide the care that these individuals need. A resident has the right to say, I don't want to be transferred. A family has the right to know that their loved one is being transferred and has a say in where they would be transferred. And so this is happening because the bottom line is, where are we going to make most of our money?
Do you see this issue within skilled nursing facilities a failure on behalf of state and local governments or nursing facilities themselves?
We all have a responsibility on this. First of all, we've allowed this to happen at the state and federal levels, so that absolutely is. We need to be paying our nursing home operators for the quality of care, not the number of residents that they have. And then I would say that it's also everybody's responsibility that if they know that there's a problem, to report it to the state. And we are now just demanding change. We're demanding change in the way we're overseeing these facilities and also in the way that they're being managed.
How do you think that this outbreak within nursing homes, especially with health experts anticipating a possible second wave of the virus, will change policies within skilled nursing facilities, or how do you hope that it will?
Well, we know that nursing home facilities, and there are the really good ones, the best practice, where they have the action plans in place on how to prevent the spread of infections, because there's always going to be infections. So having those as just as a basic criteria or basic culture. The other thing that's going to be needed is more funding for more staffing. And California is actually looking at other programs or another way to move people away from nursing homes and allow them to be in their home with more support in the home. It's not always easy to do that, especially if somebody needs 24-hour care, somebody who has Alzheimer's, dementia, a number of other conditions that require full-time care. So it's going to take a combination, but at this point, the nursing home care that we have across the nation has to change, and that's what we're demanding.
Blanca, thank you so much for joining us this morning. We're going to have all of this information on our website, turnto23.com.